All right, guys, let's do it. So, schizophrenia. Okay. Schizophrenia. And can everybody hear me okay? Everybody can hear me okay? Anyone? Oh, I don't think. Okay, but you can hear me. You can hear me? It's okay. Okay, perfect. Perfect. Okay. All right, so here we go. Schizophrenia, okay? Schizophrenia now. Heavy, 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 heavy. Times 1,000, okay? 1,000. All right. Now, I wonder why it's a heavy hitter because it's a lot of nursing interventions, okay? And it's prevalent. It's like diabetes, okay? It's a prevalent mental health disorder. So, definition, it is a chronic brain disorder, chronic, distorted thinking and emotions and perceptions, impairs daily functioning and social relationships. So, the definition is chronic, distorted, impairs daily functioning and social relationship. That's the problem right there, guys. That's the issue. It impairs daily functioning, it impairs social relationships. So the signs and symptoms, hallucination, hearing voices, seeing things, delusions, false beliefs, disorganized speech and behavior. One, two, three. Okay. I agree with this order because yes, this patient does have hallucination. Yes, this patient is hearing voices. Yes, this patient is seeing things. Yes, this patient does have delusions. Yes, this patient does have disorganized speech. Oh, I agree. I can carry out the treatments. So the treatments is antipsychotics, psychotherapy, promote adherence and treatment and a safe environment. So, what are two common positive symptoms of schizophrenia? It's hallucinations and delusions. So, for my student notes, I want you guys to understand that there's such thing as positive symptoms, and guess what? There's such thing as negative symptoms, and the negative symptoms can lead to suicide. So whenever a patient has a positive symptoms, it's like, okay, let's treat this patient, right? But when a person has negative symptoms, they become suicidal. All right. The positive is like they're actively doing things. They're active. They're active, active, active. They're running all over the place. They have disorganized speech. They have disorganized thoughts. That's a positive symptom, meaning that this patient is participating in something. But when it's suicidal, like when it's a negative, then we know, oh my goodness, this is very dangerous for us. This is a high risk patient when it's negative. So, background, Mr. D, 24-year-old male, brought to the emergency department by his family after they noticed increasing social withdrawal, disorganized speech, auditory hallucinations, bizarre behavior over the past 6 months. He has stopped attending college. He rarely showers and expresses persecutory delusions. The government implanted a chip in my head. So the provider diagnosed schizophrenia. All right. So the signs and symptoms of schizophrenia, yes. Okay. Signs and symptoms, I agree with. So whatever the treatment is, I agree with the treatment. What is my nursing intervention for schizophrenia? How do I communicate with this patient? All right. I know the patho, right? Patho is a patho. The signs and symptoms are there. But now they want me to do my job. What is my nursing intervention for a patient who has schizophrenia? How do I communicate with this patient? So the approximate analogy, which is your patho, right? That's your patho. Schizophrenia is like T trying to watch multiple TV channels at once. Thoughts, perceptions, and emotions become fragmented and overwhelming. So, schizophrenia is like trying to watch multiple TV channels at once. Multiple. So, let's look at physiological integrity. Let's look at our vital signs here. So, temperature is okay. Pulse, oh, this is a 24-year-old, and his pulse is at a 94. Respirations, this is a 24-year-old. Respirations are at a 20. Blood pressure, and he's on room air. So I'm not going to give him anything for this pulse. I'm not going to give him a beta blocker because that's not going to fix anything. I'm going to figure out how to treat the underlying cause. The underlying cause, what's causing his blood pressure and his pulse to rise and his respiration, is the schizophrenia. So I need to treat the schizophrenia. So my nursing notes would be physiologically, yes, his heart rate is elevated, but I'm not going to give him a beta blocker. What is that going to do for the schizophrenia? The schizophrenia is what's causing it. So I'm going to treat the underlying cause. Nurse notes subjectively. The voices tell me people are plotting against me. Objectively, disorganized thought processes, poor grooming, flat affect, pacing, responding to internal stimuli. So this patient has disorganized thought process. Objectively, that's what the nurse sees. He has poor grooming. He has a flat affect. Nursing actions provide reality orientation. That's your test question right there. Maintain calm communication. That's your test question right there. Assess safety risk. That's your test question right here. So this is all you. This is what's going to be on your exam for schizophrenia. Okay? Provide reality orientation. That's a nursing intervention. Maintaining a calm environment. That's a nursing intervention. Assessing safety risk. So my student nurse notes, what I have seen on the exams is reality orientation for a patient who is experiencing hallucinations. Reality orientation, not arguing, but reality orientation. So, interactive clinical judgment model. So, what are the cues for schizophrenia? Auditory hallucination, check. Delusions of persecution, check. Disorganized speech behavior, check. Flat affect, check. Poor self care, check. Social withdrawal, check. Okay. Whatever the doctor tells me to do, I can do it because this guy has schizophrenia. Analyze cues. What do these findings suggest about the patient's condition? Consistent with schizophrenia. He has positive symptoms, guys. Oh. He has positive, look at that, positive. But he also has what? Negative. He has both. Now, which one leads to suicide? The negative. Now, remember, guys, this is NCLEX world. Okay, this is NCLEX world. So, in NCLEX world, a flat affect, withdrawal, schizophrenia, that's considered negative symptoms. These alarm us. As a nurse, this is a red flag for us, guys. Negative symptoms. Prioritize hypothesis. Which patient problems are most urgent and why? Risk for self harm, risk for self other harm due to hallucinations and delusions. That's my priority. Okay. Risk for self other harm due to hallucinations. And so I need to make sure that my reality orientation is on point. That is my priority. Now I know that this patient has positive and negatives. When the patient is negative, it would be a suicide risk. But you see how he has those positive symptoms? So he's hallucinating. He has delusion. He can hurt himself and he can hurt others too. So generate solutions. What possible nursing interventions could address safety, structured environment? Okay. Safety, structured environment. Reality orientation is my priority. Administer antipsychotics. Use clear, simple communication. Encourage ADLs, involve family and care. But my first thing is safety, and I can provide safety for this patient and others by providing reality orientation. Take action. Administer prescribed antipsychotics. Stay with the patient during hallucinations. You see that, guys? So you cannot, that's your another test question, guys. That's a test question. You cannot close the door and leave the patient in the room. Stay with the patient during hallucinations. Reality orientation. Reassure safety. Limit external stimuli. Encourage small, achievable self care tasks. Outcomes. Whatever was wrong is better now. The outcome, where the outcome was it met? Were our goals met? Yes. The patient will report decreased hallucinations. The patient will report fewer delusional statements. The grooming will improve. So my takeaway, again, my priority nursing interventions right now is safety, right? Safety, reality orientation. And what I have seen on exams, guys, in the past is shut the door, leave the patient in the room and shut the door. That's a form of it's not assault, but it's a tort. It'll come to me of false imprisonment. All right, it's false imprisonment. So you never, even though he's having hallucinations and he is in psychosis, you cannot leave a patient who's going through these things alone in the room. All right, medications, um physiological integrity and pharmacology. So this patient will have first generation antipsychotics. Look at that, haloperidol. Second generation antipsychotics, long acting injectables, and nursing considerations. So this is you, right? This is you, nursing considerations. So you want to monitor this patient for EPS like dystonia, akathisias, Parkinson's, Parkinsonism, and tardive dyskinesia. But remember, this can be treated with medications. You can give the patient benztropine to treat this, so that doesn't this patient doesn't have to stop taking his antipsychotics because of EPS. We can handle that. Watch for neuroleptic malignant syndrome. So if this patient becomes rigid or has a fever or autonomic instability, that's also something I have to monitor for. I have a very good example for you on my TikTok. And clozapine, with monitor for WBCs and absolute neutrophil count due to agranulocytosis risk. So your nursing considerations, the heavy hitters here are EPS and NMS. All right. Make sure that you know this inside and out, because these are the adverse effects that can occur when you're giving someone these medications. These are some serious medications. So diagnostics and labs. All right, diagnostics and labs, they can hit you in two ways, right? It can either be they just want to make sure you know what labs or what diagnostics procedures for schizophrenia, or they may want you to do some things preoperatively, intraoperatively, and postoperatively. All right. So remember, we're trying to reduce the risk. We can't just send our patients down to labs and diagnostics and not know, does this patient need a consent? Should I be pulling this before he goes down for that? So pre-treatment, CBC, CMP, glucose, lipids, baseline ECG. That is not too invasive. During treatment, ANC monitoring, weight, metabolic labs, EKG, QT prolongation, and post treatment, ongoing psychiatric eval. Symptom reassessment using the positive and negative syndrome scale. So, my takeaway would be absolute neutrophil count monitoring. Absolute neutrophil count monitoring. Okay. So if this patient has let's say for instance, if they have, N is NMS, neuroleptic malignant syndrome. So you have to just make sure that you're monitoring their absolute neutrophil count, and if they're taking clozapine, you have to monitor their white blood cells and their absolute neutrophil count due to agranulocytosis. So if there'll be an increase, right? So it'll be elevated. ANC will be elevated. So again, my takeaway would be ANC elevation, because it's like the body is fighting off an infection that's not even there. NMS, which is neuroleptic malignant syndrome. All right. Sidebar, sidebar, right? Sidebar. So you have a lot of mental health nurses, right? And if you guys work in mental health, you can probably attest to this. It's a very, very easy job, right? It's very easy, okay, because you have a behavioral health tech that helps you with pretty much anything. But if you're not monitoring the labs, and sometimes we get very like complacent and we're giving the patient these antipsychotics and we're not monitoring their white blood cell count, we're not looking at their CBC. And this patient could very well be suffering from neuromalignant syndrome, and the nurse isn't the one that's going into the rooms doing the Q 15-minute checks. So the behavioral tech may not recognize the signs and symptoms of neuromalignant syndrome. Okay, a behavioral tech isn't responsible for monitoring a patient if your patient is starting to experience negative syndrome or negative symptoms. So it's a very, very easy job until something goes wrong. So make sure that if you're working with a patients in NCLEX world and they're getting their antipsychotics, you have to know your absolute neutrophil count. You have to monitor this patient for neuroleptic malignant syndrome. And you have to monitor the CBC because you're looking at the white blood cells because it'll increase. Priority nursing intervention. All right. So now this is you. This goes in red. This is your priority nursing intervention. So they're going to hit you with your nursing interventions. So the number one thing for your patient who's experiencing hallucination is maintain safety, suicide and violence risk assessment. Use short, clear, direct communication. Do not argue with delusions. Instead, focus on feelings. So this is huge. I'm going to put this, where's my red marker? Do not argue with delusions, guys. Focus on the patient's feelings. Try to calm the patient down. Encourage ADLs. Reinforce medication adherence. Even if they develop EPS, remember, we can treat that. Promote family support and psychoeducation. So, my takeaway, one thing I know when it comes to therapeutic communication, guys, they want you to have short, clear, direct communication and do not argue with delusion. Focus on feelings. So, nursing skill, this is your psychomotor, this is your hands on. Therapeutic communication is a skill. All right. Mental status exam, perform mental status exam, assess for hallucinations, assess for delusions, give the patient the antipsychotics, but you know EPS is an issue, but we can treat EPS, right? We can treat EPS in MS. So we have to monitor the ANC, which is the absolute neutrophil count. We have to monitor the white blood cells. Teach and reinforce coping skills, so distractions and grounding. Provide ADL assistance and document objective behaviors and progress. So, again, my takeaway would be EPS, right? But that's okay because we can treat that. We can treat those motor movements. We can do something about that. We can treat the Parkinson like symptoms. We can treat that. That's okay. NMS, I'm going to pull my labs. I'm going to tell the doctor to give me an order for ANC. I'm going to tell the doctor to give me an order for white blood cell because that's what a safe nurse will do. Now let's fill it out. Fill in the blanks. Schizophrenia is characterized by both positive and negative. All right. An example of a positive symptom is hallucination, delusions. An example of negative is what? Flat affect or social withdrawal. We're afraid of this because we know what? Suicide. We're afraid of negative. Clozapine is the only antipsychotic requiring regular ANC, absolute neutrophil count. You have to pull it, you have to get the order. A life-threatening complication of antipsychotic is neuroleptic malignant syndrome. Neuroleptic malignant syndrome. So monitor this patient for like a fever. The PANSS scale measures positive and negative symptoms. Nurses should avoid arguing with delusions, but validate feelings. I'm not saying validate, oh, there's spiders crawling all over you. Oh, yeah, I do see the spiders. No, you can say, oh, yes, I can understand how you can be so frustrated. I can understand why you're so afraid. But I'm never going to say, oh, yes, I see the spiders too. No, I'm going to say, I understand you're afraid. I'm going to validate their feelings. All right. 8. Second generation antipsychotics have a higher risk for metabolic syndrome, second generation. And a priority nursing diagnosis is risk for self harm. Patients should be encouraged to participate in structured activities. So, my takeaway again, guys, is going to be therapeutic communication. Validate the feelings, validate your patients. If he's scared, oh, I understand why you're scared. Oh, you're this. Oh, I can understand. It's validating the feelings. I'm not saying, oh yeah, I do see the spiders crawling under your skin. Or I don't see anything under your skin. You're just gonna I understand why you're scared. So validate the feelings. Discharge, health promotion and maintenance. Take your medications exactly as prescribed. Report EPS. Report neuroleptic malignant symptoms or sudden mood behavior changes. Follow up appointments for lab work. Remember, WBC, ANC, healthy lifestyle, coping strategies, structured activities and social programs. Educate family on signs of relapse. Avoid alcohol and develop a crisis plan for worsening psychosis or suicidal ideation. So, my takeaway, guys, would be EPS, NMS. Make sure you know what EPS is and NMS, especially for mental health. All right, guys, that is that for this session. So we're back. Let me stop the recording.